The question foremost in the minds of Metro Manilans and those in the NCR bubble, of course, is whether this ECQ will be extended. What is the likelihood that it will be extended?
Well, kailangan po natin maintindihan, in this 1 week that we will have for this ECQ, we won't see any changes in the numbers, or we won't see any changes in the utilization rates in our hospital. This is so short a time for us to do that assessment and have that effect. And we know that there is this 14-day period of incubation for our individuals with COVID-19. So hindi po natin yan makikita. So ang magiging basihan po natin if we are going to extend or not, medyo nagkaroon na po ba tayo ng augmentation dito sa ating mga ospital? Naiayos na po ba natin yung referral system natin? Nagkaroon po ba tayo ng step-down care facilities para matanggal natin yung mga mild and asymptomatic sa ospital para makahinga ang ospital? Ang local governments po ba ay nadagdagan yung kanilang pag-iigting ng kanilang PDITR, doing the code strategy, doing house to house? Kasi kung nagawa po natin lahat yan, and then we can say that even if we lift some of the restrictions at hindi tayo mag-ECQ, tayo ay kaya natin, we can accommodate even if the cases will rise because our system will be more ready.
Ma'am, doon po sa isang nabanggit nyo, kamusta nga po ba? Temperature check tayo sa public health system natin, both in terms of the capacity of our hospitals at saka yung vaccination program sa ating frontliners. Kamusta na po?
Yes, when it comes to hospitals, if you would look at our healthcare utilization rate, makikita po natin sa buong bansa we have 63%, no? And ibig sabihin yan, you have 37% available. If you zero in on the National Capital Region, meron tayo about 70% na utilization, meaning may 30% pa. Pero what would be most important that we are looking at right now would be our ICU utilization. At pag tinignan po natin ang ICU utilization, especially here in NCR, we are at that critical risk already. Aside from that, tinignan din po natin yung emergency rooms natin at nakita natin talaga overflowing ang mga pasyente. Kaya nga po sabi namin, we have to impose this restriction right now nung time na nag-recommend tayo, or else we will really get overwhelmed already. As to vaccination, we had been able to vaccinate already 63% of the targeted master listed healthcare workers na binigyan natin ng initial first dose. Actually, for today, nag-umpisa na po yung mga nagsi-second dose. And every day naman, nadadagdagan tayo, and we will do simultaneous vaccinations already. We started last Sunday, kahapon po na nag-announce na, nag-umpisa na rin ng local government. So hopefully, this measure also we can add to the protection for the individuals in the population.
No, go ahead.
While we were talking about the need for step-down facilities to move the mild and asymptomatic cases out of the hospitals, I was wondering how that's going. Kasi the last time we talked to the private hospitals president, si Dr. Rene De Grano, he was saying 98% ng mga kaso sa kanilang mga ospital are mild to asymptomatic na kailangan lamang paracetamol at cough syrup. At nahirapan daw silang ilabas itong mga ito dahil nandun na. So we're wondering how that's going.
Yes, tama po yan, sir. No? When we did our assessment also, we made the rounds of our hospitals here in NCR. Talagang yan po ang nakikita natin, yung mga mild and asymptomatic po, almost 50% of those admitted are this type of patients. So paano po ba natin yan gagawa ng paraan? Una, kailangan natin ng step-down care facilities. So meron po tayong mga tinatalaga ngayon na step-down care facilities. Gumagawa po ang ating DPWH through the leadership of Secretary Villar ng mga additional units para po pwede nating gamitin for this. Another thing would be, pinag-iigting po natin ngayon ang triaging. So we encourage our local governments na sana sila rin magkaroon na ng triaging doon sa local governments pa lang para hindi na dumidiretso sa ospital ang mga kababayan nating nagpapanik kasi sila kaya diretso ng diretso sa ER, napupuno po tayo. But if we have this streamlined process from the local governments to our hospitals, and then we'll be able to further decongest our hospitals.